I understand. How did your particular office become involved? I understand, is this like a franchise? Is that what you're saying?
Well,
it's like a franchise?
We are, Right at Home itself is a franchise, but this particular transitional care program is not a franchise. It's one of our programs that we have for the frail elderly. It in and of itself is one of the services that we provide, because again, there are just millions of people across the country who are in the situation where they need just a little bit of help to remain in their own homes, and they need some assistance with bathing and dressing, and just companionship. Sometimes people are just not able to get to the grocery store. They can't run their basic errands. Some of our caregivers take people to church, and
that's wonderful.
they are, so the activities that we're involved in with the lives of the seniors, they're as varied as the number of people that we're servicing, from hairdressers, doctor's appointments, just helping them be an extension. We like to say we're an extra pair of eyes, ears, hands, and feet for our clients.
Yes.
And it really helps them to get along and to be independent as long as possible.
What are the qualifications? What would qualify someone for this type of program?
For the hospital to home program, the criteria, again, there were people who were coming to the emergency department unnecessarily. So you had to be, in this particular pilot program, you had to be at least 65 years of age. You, when looking at the statistics, the patients probably had visited the emergency department 3 times within 6 months. They had visited their doctor 3 times within 6 months. They had some comorbidity, such as diabetes, or they may have had congestive heart failure or COPD, pneumonia. Those are some of the popular reasons people are going to the emergency department. And what happens is the hospitals do a wonderful job of providing them with information and clinical care and what they need to do to follow up. But unfortunately, when you're average age 85 and you're getting a thick stack of information to follow, and reading is hard and you're by yourself, it's just difficult for them to follow all of those great instructions. So they need an extra pair of hands, and what the hospital to home program does, it helps the individual to navigate through that process. So there's a navigator within the hospital who collects all this information and helps to work with the patient in the hospital and all the other healthcare providers. And then there's a navigator right at home that communicates with the hospital navigator. And then there's a caregiver that actually goes into the home to help the individual follow all those instructions and then go back for their follow-up visits and so forth, and get their prescriptions and eat properly.
Right. I know my mother has so many medications, and I'm sure just having someone to help with all of those daily medications, and because the elderly sometimes get those all mixed up, so they can help with that as well. Who actually founded this program? How did it originate?
Well, this particular program for hospital to home was founded at Forsyth Medical Center in Winston-Salem. Right. The director of case management, Crystal Redding, was the person that invited us right at home to participate. And she said to us, to the reporters at the time, "Why did you select right at home?" She said, "Because I would select them for my own mom."
That is great. That's a great testimony. Where does the program go from here? What are your plans? What are your future plans for Right at Home?
Well, for us, we're working with the Forsyth Medical Center, and I think that they are now helping the community at large, and they're partnering with other hospitals and other healthcare providers, because the federal government, again, is looking at reducing expenses in Medicare. And this is a great way to do it, because there's a lot of reimbursement happening, and it's happening unnecessarily so. But helping the community work together. So my wife and I are working with communities across the triad, and hospitals and other healthcare organizations and insurance companies even, to put together a program that will benefit the community at large.
Okay, that is great. How would someone get in touch with you? They're listening and they have more questions about this program. How would they contact you?
Sure, they feel free to give us a call directly at 336-760-7131, or go on the internet at www.rightathome.net, just the way it sounds, RIGHTATHOME.net.
That name is so appropriate because it's in-home care. I want to thank you, Mr. Brewer, for being with us today. You've been very informative. And if anyone has any questions, then they can go to your website or they can give you a call.
Absolutely.
Okay. All right. Well, thank you for being with us today. We'll be right back.